All right, here we go. NSCA, Chapter 19. We're talking about clients with nutritional or metabolic concerns. Specifically, we'll be talking metabolic syndrome and diabetes mellitus. Um, so with metabolic syndrome, then they abbreviate this as MET-S. Um, it's a it's a condition that kind of evolves over time, and what they're really getting at is this is a process that evolves over time, but there's also ample time to have interventions, whether it's just nutrition, working out, whatever that may be. We have the ability to intervene in this process. And with metabolic disease itself, and we've talked a lot about metabolic disease and metabolic syndrome, but we've kind of talked about it in the context of like the 8+1 and looking at the little footnotes, etc. If you take the time, just pause me and kind of read through this paragraph does a really good job of kind of encapsulating a lot of the things we've been going over in our case studies as well as just in the lectures for this course. So I urge you to take a moment, just kind of read through this and get acquainted with this because it does a really good job and it's nice and tight here. The other part of this is when they talk about having metabolic syndrome, they talk about abdominal obesity, waist circumference above 40, and then waist what 35, I'm sorry, 40 or 35 for men or women. And they talk about hypertriglyceridemia, that's the above 150 we talked before. The reduced high density lipoprotein, that's the number 40 if you recall, and 50 in women, but in general it's usually classified as 40. And then you have elevated blood pressure. And then last on the list there is fasting glucose above 100. So these are like the main things that we've talked about in depth and at length for that 8-in-1 format. And again, it's kind of being all tied nicely together in this chapter. And so if you ever, over the course of this class or our Kinesiology 230, had difficulty kind of wrapping yourself around, or 231, excuse me, wrapping yourself around like that 8+1, this is the chapter where you really want to focus some time and energy. With metabolic syndrome, they kind of have that android shape or apple shaped body. They usually have, fat more in the abdomen than anywhere else. And there's a correlation between that and cardiovascular disease. And then you look at this and they talk about the passage in the right here, they talk about, the process of very low density lipoprotein to low density lipoprotein and the relationship of those to android obesity. So as they get a little bit further into the chapter, they go, the nearby liver uptakes the fat and produces very low density lipoprotein molecules, which transport triglycerides to the cells of the body. Upon releasing triglycerides, very low density lipoproteins convert into LDLs. It is the LDL molecules that carry large amounts of cholesterol and deposit it around the body. That takes us back to the hardening of the arteries, that atherosclerotic condition. And so when you look at this kind of risk of cardiovascular disease or coronary heart disease, as they write here, it's a matter of this and how the mechanics of very low density lipoprotein become LDLs, and LDLs carry the cholesterol, and the cholesterol is what gets stuck on the arteries. But what we know is this. We know that exercise and good nutrition are excellent interventions to help with all of these. And so, here we are as practitioners. It's a matter of understanding the things that help slow, stop, or even reverse some of these processes. And what I like about this is they note here towards the end, the elevation in triglycerides is also believed to disrupt blood glucose regulation. The resulting rise in insulin levels may in turn stimulate sympathetic nervous system regulation, which increases blood pressure. This is because you have the parasympathetic and the sympathetic sides of the autonomic nervous system. The sympathetic side is the fight or flight. The parasympathetic side is the rest and digest. So if we're stimulating or upregulating the sympathetic nervous system, we're creating a fight or flight response, and that fight or flight response requires our bodies to send more blood through the body because we got to run somewhere to get away from the saber-toothed tiger that's trying to eat us. It's going to then, by upregulating our sympathetic nervous system, increase blood pressure. So you can kind of see the evolving deleterious effects that you have from one thing begetting another to another to another. It's like a series of dominoes all toppling over. They talk about, in the book here, they talk about uncontrolled blood glucose levels, and they note three main types of diabetes mellitus: type 1, type 2, and gestational. And when you look at evaluating blood glucose levels, we talk about like that cut-in number for fasting of being 100. The book in one part of the chapter notes 126 or higher, which I thought was confusing, but I just want to point that here. If we go back to like our 8 and 1, it's 100 or higher. You can also use a 2-hour post-meal measurement as well. But long story short, when we look at type 1 diabetes itself, it's associated with any number of different conditions. But when you look at type 1, these are people who have had diabetes probably long before they met you, and they've learned how to regulate. They have some kind of injection pump. They have some kind of medicinal intervention as a result, and they know how to manage this type of diabetes. But you still need to be aware of it, because you might have some days where your person feels off, or they don't feel good, or maybe they want to just maybe adjust their workouts a little bit because of their diabetic condition, and they might feel a little bit off, and they're just a little bit cautious on that day. So, you have to kind of respect that. When we get into type 2 diabetes, with type 2 diabetes, that's going to be about 90% of the people you see who come in and say they have diabetes will be this. And it's usually associated with family history of diabetes, older age, poor dietary choices, or even lack of exercise, which we can intervene on a couple of those, which is great. You can't intervene on the age or the family history, but on dietary choices and lack of exercise, absolutely we can jump in and help that person. But the book definitely wants you to focus on this. The treatment for type 2 diabetes usually includes some kind of diet modification, weight control with regular exercise, and perhaps some type of oral medication, hypoglycemic agents, to help the person out. That'll be found somewhere else. Gestational diabetes mellitus is a condition during pregnancy in which glucose levels are elevated and other diabetic symptoms appear during pregnancy who have not previously been diagnosed with diabetes. And we talked a little bit in terms of special populations before about pregnant clients. This would be one where when the person walks in, they will know they have gestational diabetes mellitus. It's almost understood that they'll have that diagnosis from their doctor. Now, the thing you have is this. You still need to pay attention to your clients who are pregnant when they come in. They may not have been diagnosed, and they may end up having, while they're working out with you, some type of reaction where they don't feel quite right. They go to their doctor and they come back 2 or 3 days later and like, holy cow, I have gestational diabetes mellitus. Here's what my doctor said to do. So that's usually the course of action that happens with that. They already know that they have diabetes, gestational diabetes. But to a certain degree, in the rare case that the person will come in not knowing that, you just need to be aware of the signs and symptoms when a person who is diabetic starts to go into a little bit of a shock mode. Now, the book does this. It defines and describes a condition of hypoglycemia where a person has low blood glucose levels. And I will say this: if you have a client who is diabetic and they know they're diabetic, they're going to be quite skilled at administering however many units they need. They know exactly the amount. And for some people, it might be, 1 unit, half a unit, 2/3 of a unit. They know. They just know. They have a really strong understanding of their own nutrition. They know when they're having a good day. They know when they're having an off day. And they'll articulate that to you. And to that end, when you have hypoglycemia and you have people who are, kind of aware of this, they'll probably have medication on board. If they don't, it helps you to have a couple things here. One, understanding of some of the signs and the symptoms they can't articulate to you what's going on. But the other side of it is you'd have a conversation with your client beforehand. Okay, you're diabetic. Let's just say you're showing signs of symptoms and you don't have any meds on board. What can I get you? How can I help you in that situation? What's the best course of action that you've found? And it might be just, I need you to go get me a couple crackers. And it could be as simple as that, but make sure you have that conversation on the front end with your client. And that way, God forbid, if something should happen, you'll be well informed on how to act in that moment. And you don't need consent from your client to call 911, but if your person actually starts to fade away and pass out on you, then yeah, you're calling 911, no questions asked. They much like the other sections, they did the same thing over here for diabetes. They talk about the mode of exercise, aerobic, resistance, and flexibility, and they give you some nice guidelines to follow along, which I think are all great. And they all kind of follow, if you will, the minutes per week of vigorous intensity, moderately vigorous intensity, to over here where you're at moderate to vigorous, and they give you the percentages, etc. This is actually a really good starting off point for many of your clients, and you can probably look at this and craft a number of different workouts for your clients. And then when you start working with them and get hands-on, be able to kind of manipulate some of these rep and set schemes and even some of these percentage schemes to make them more appropriate to the person that's right in front of you, because it might be a little bit different than what they're suggesting here. So I urge you to kind of pause me and read through this and just kind of take a few moments to just associate yourself with the list here and have an understanding of what they're trying to get across in terms of a workout. So with this, guys, I'm going to jump over to the last and final presentation. I'll be right back.